It was a day of jubilation and learning at Mazi Village, Kamira Sub-County, Luwero District, as Concern for the Girl Child, a non-government organization connected with the community. The organization engaged beneficiaries with a free health camp where 150 people were tested for HIV/AIDS, 7 screened for cervical cancer, and 90 screened for breast cancer.
And we have managed to do screening for over 90 girls and women in this community, where we have found only 3 are suspicious of having breast cancer, and we are moving them referring them to, that is, Uganda Cancer Institute. Gift Enhanced Network itself is taking them to the Uganda Cancer Institute so that they can get further the checking.
Today we are in Mazi, Kamira Sub-County in Luwero, celebrating with the community and connecting with the community. We choose one day in the year to connect with our community in Mazi.
Catherine Opondo, the Executive Director Concern for the Girl Child Uganda, says Luwero District needs special attention to bring back its lost glory.
Historically, there are many men, women and children that suffered the after effects of the war in the past, and Luwero District remained vulnerable. 2001 was the area where we chose Luwero because girls and boys were vulnerable, but specifically the girl child. And so we chose Luwero because we wanted to empower women and girls.
Opondo says about 29,000 children, especially girls, have benefited from their program countrywide and appealed to government to put more emphasis on infrastructure development in rural areas.
Government is doing a lot of work. However, there are still gaps. The gaps exist because the population is growing at an immense level. We still have a lot of work to be done. I feel that for the district of Luwero, if government could increase infrastructure in these remote areas, I'm referring to the road network, I'm referring to electricity so that we don't have to struggle with rural electrification.
Concern for the Girl Child was founded by Dr. Anne F. Hayes and the late Freddie Henry Kasozi in 2001 to empower the vulnerable girl child in Uganda, and the impact has split over the surrounding communities through provision of access to education and health information, as well as advocating for the rights of children. Communities in Luwero, Nakaseka and Kampala in Nakawa Division have been reached. Bernard Higa, UBC.